You're listening to the station that serves your community. AM 1240 WGBB.com and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to helping you live better, healthier, and longer. I'm your host, Dr. David Scharf. Thanks for tuning in. We have a great show scheduled for tonight. We have Dr. Danny Aldieri, dentist from Farmingdale, New York. Danny, welcome to the show.
Thank you, David.
You're the A in KFA Dental.
Yes, I am.
Right? And we've had K and F on the show, so it was time to have A. So thanks for coming down tonight.
Well, thank you so much for having me on. And now your show is truly complete now that you have the A on.
Yeah. So we're going to have a great show tonight, and we're going to talk about cosmetic dentistry, some other things. But before we get started, maybe just tell listeners where you grew up, where you went to dental school, that sort of thing. How you ended up in Farmingdale.
Sure. Well, I'm proud to say that I'm from Staten Island originally. I wound up going to a dental school at NYU. And then I settled in Farmingdale. My wife, who also happens to be a dentist, she's from Farmingdale originally. So
enough said. Now we know why you're in Farmingdale.
That's why I'm in Farmingdale, and that's it. And we lived happily ever after. No, I love Farmingdale. It's a great town, and I love being on Long Island.
It's nice to live where you practice.
Yes, yes, it is. It's not such a busy commute, and it usually takes me about 3 minutes. When there's traffic, it takes me 5.
That's not bad at all.
So not bad at all.
So do you run into patients a lot around town, or is that a pretty common thing?
It's very common. We always we're out and about in the town. I have a 6-year-old and a 4-year-old, and so we're always doing stuff. We're getting into t-ball now, so we're always out, and we always run into patients. And I'm always so happy when we run into patients, because our patients are like family, and we treat them like family at the practice. So it's just it's a great town.
You know, to me, it's sort of a whole different dynamic when you practice where you live. A lot of dentists practice 20, 30 miles from where they live, and they never see their patients, but you really establish a relationship with them. You're part of their community, and that's kind of a nice thing. Yeah,
absolutely. I really do think that we have an advantage, that we're lucky in that we do practice where we live, and part of that is by design. I think both my partner, which is my wife, and I always wanted it that way. Incidentally, there are 3 partners, just for your information. Myself, Dr. Angela Ferrari, and Dr. Donald Kahn, and the 3 of us all practice in Farmingdale at the same practice.
Very good. So my favorite question I always like to ask people is why you decided to. How old were you when you knew you wanted to become a dentist?
I remember exactly. I was 7 years old, and that was the first time that I went to the dentist. And I remember that at the time, the dentist, he was standing up, and I was in the chair, and he raised me up, and I was able to look at all the instruments and what I thought were cool little gadgets he had on the countertop. And so ever since then, I said, wow, this is something that I'm interested in doing. But more importantly, I had such a good experience there, and I remember, I think he did a filling on my tooth, and I had the happy gas and all that stuff. I remember that I had such a good experience there, that now when I do practice and when I do see patients, I remember that experience that I had, and I try so hard to make every experience for my patients a good one every single day that we see them. So that has my experience when I was 7 at the dentist had a big impact on me, and I'll always keep that with me.
Mm. Do you still have the whistle you got at that visit, by the way?
The whistle?
The whistle you go to the treasure chest when he was done?
Oh, my God. I think we had balloons and little toys. Yeah, I still have it. I kept it, yes.
You know, it's funny. Almost every guest that's been on the show that I've asked that question has had a similar type of a response where a dentist at a young age or some point in their formative years really had an impact on them, and that's what they decided to become. I don't think I've ever interviewed a dentist who said, in my 3rd year of college, I decided to be a dentist. Almost always it was younger, so that's kind of interesting.
Yeah, I think it's something that you really, I think you develop for some way, shape, or form a passion for. I think when you're really young, anyway, and that's what happened for me.
So let's get into tonight's topic. I want to talk to you a little bit about cosmetic dentistry and help our listeners understand maybe, what cosmetic dentistry is and, what's out there. So tell me a little bit, who's your typical patient maybe that comes in for a cosmetic dentistry or cosmetic makeover?
Well, I could tell you that there is no typical patient. Everyone is different and they have their own unique set of circumstances. But generally speaking, patients come in looking for something specific. Some people don't like the color of their teeth, or they haven't been able to smile. They say, I haven't smiled in years. They don't like the shape of their teeth. Maybe they're crooked. So typically, patients, they're not happy with with how their teeth look now. Maybe they don't like how they look in pictures or photos. That's the, I guess, quote unquote typical patient that comes in as wanting cosmetic dentistry.
Do most people come in and can they articulate what it is about their smile they don't like, or most people just sort of say, I just hate the way I look in pictures?
We have both. Some people come in and they are very specific. Some people bring in pictures of who they would like to look like, pictures that they see in magazines or pictures of models. And they're very specific in terms of what they want. Other patients, they know they want to make a change. They could tell you that they don't maybe like the shape of their teeth or how their teeth look, but they don't know exactly what it is that they need or that they would like.
So how do you approach these patients? Someone comes in and they're just, in general, they say, I hate the way my smile looks. How do you take them from where they are to the end result where they're happy with what they have?
Well, it all starts by a conversation. I believe it or not, I interview all of my patients, especially cosmetic patients. And when I say interview, I mean that we spend a lot of time having a discussion as far as what they're happy with, what they're unhappy with, what they'd like to see change, and that it's very important to have extensive communication so that you could really figure out what the patient is looking for, because there are all sorts of different levels of cosmetic dentistry someone could have, and so different people would be happy with different types of treatments depending upon what their needs are.
I would imagine you need a certain amount of tact. Somebody comes in with not happy with their smile. How do you sort of tease out from them what makes them unhappy versus what you look at their smile and say, boy, I would fix A, B, and C, but it turns out they're only unhappy with A?
Sure. Well, that's part of the interview process or the conversation process. What happens is, along with that, when a patient comes in, a new patient comes to the office, routinely we'll take x-rays of their teeth. We'll take a full set of photographs, cosmetic photos, smile shots, resting smiles, large smiles, laughing pictures. We try to get the patient in their natural state, and yet showing what their teeth look like. And then we could sit there and we could look at their photos on the monitor, and the patient could actually point out the things that they like and the things that they don't like. And from there we could start to design what the patient's smile could look like, given what the patient points out to us. So the patient always guides us in a certain direction, and then from there we can make recommendations as far as the type of treatment that they would like to have.
Are these cosmetic cases or enhancements, whatever you want to call them, are they always sort of big cases, big to-dos, or is it sometimes really a minor thing that makes a big difference? Yeah,
that's a good point. Sometimes they are a big to-do, and sometimes not. It's dependent on what the patient needs are. Sometimes people come in and they just need to have their teeth whitened. Maybe they're just dark or stained. Other times people have crooked teeth and they say, oh, my teeth are overlapped, or I'm always getting food trapped in certain areas, and that could be frustrating for them. So sometimes we would straighten their teeth with invisible braces called Invisalign. And other times people need a combination of things such as veneers, which we'll talk about, or crowns, or bonding. So the range of cosmetic dentistry involves many, many different types of treatment, and they're all tailored to what the patient's needs are.
Do you see a lot of people who come in for this kind of dentistry that have maybe been away from the dentist for a long time?
Absolutely. Sometimes patients stay away for years. There are reasons for that.
We're gonna take a fast break, and then when we come back from the break, I'm interested to find out what some of those are. You're listening to Healthy Living Radio. I'm your host, Dr. David Scharf. We'll be right back.
This is Healthy Living Radio with Dr. David Scharf.
Okay, we're back. I'm Dr. David Scharf. You're listening to Healthy Living Radio, and our guest tonight, Dr. Danny Aldieri, general dentist from Farmingdale, New York. And before the break, we started to talk about cosmetic dentistry and how some of the people that you're seeing maybe are people that have been away from dentistry for any length of time. What's the longest maybe someone's been away that you? There's probably someone listening that's saying, no one's ever been away from the dentist longer than I have. What's maybe the longest someone's been away that you've treated?
Believe it or not, I had a patient not too long ago who hasn't been to the dentist in over 20 years.
And that's probably not terribly uncommon, I would think.
It's not so uncommon. 20 years is a long time for not to have problems, but it's not as uncommon as one might think.
And what brought that patient in after 20 years?
Well, believe it or not, it was her smile. She had been fearful for the dentist. She had some bad experiences in the past when she was a child, and so I think the last time she had gone, she was a teenager. Mm-hmm. And now she was in her mid-40s, I believe, and her teeth were stained. They were crooked. They were dark, and she was in a relationship, and there was a wedding looming in the not too distant future, and so that was in her particular case, that was the motivation for her to come in and finally have dental care.
I bet you a lot of people listening think that it's uncommon to be away from the dentist from a long time, but I know we were talking before the show that it's really pretty common that people have been away for years and years. So anyone listening that's in that category, I don't think you should feel embarrassed. You're telling me it's a common thing. What are the most common reasons you've seen over the years that maybe people stay away from the dentist? And do those end up being valid reasons, or are their worst fears recognized?
Sure. So yeah, it is not uncommon for people to stay away from the dentist. And what we found, and usually there are 5 reasons why people will stay away. One is fear. They're just afraid of the dentist. They're afraid it might hurt. Mm-hmm. Some people are afraid of what we might find when we look inside.
So let's just talk about, I'd like to go through these one by one maybe. So what is, for people who haven't experienced modern dentistry, I mean, what are the different ways that you can control their pain or anxiety to make that barrier drop away?
So the first thing I'd like to say to anyone out there that is listening that hasn't gone to the dentist in a long time and they're fearful is that it doesn't have to hurt. These days we could do dentistry and it could be a comfortable experience. A lot of that fear comes from the fear of the unknown. So we spend a lot of time, like we were saying, talking to our patients, letting them know what they can expect, how things might feel, if they're going to feel pressure, if they're going to feel us tugging on their cheek. Some people are fearful if we touch them a certain way, or they may be afraid that they're gonna choke or something like that. So we figure out what those fears are, and then we address them appropriately. If they are fearful of pain of the actual dental treatment done, there is always local anesthetic. There's always sweet air. Patients do very well on the sweet air. Sometimes that's called laughing gas.
You did great on the laughing gas when you were 7.
I really did. They used to call it a Mickey Mouse.
Look how it helped you.
Mickey Mouse knows. That's right. I wouldn't be here today if it wasn't for happy gas. So I could thank the laughing gas for that.
And people can be sedated also for that. They can sleep through the dentistry if they want to.
Absolutely, absolutely. We could sedate them in the office. Patients could sleep through the dentistry, and they could wake up and have their dentistry all completed. So there are different things that we could do to manage, quote unquote pain, if that's what people are afraid of. But one thing that I do want to stress is that it does not have to be painful nowadays.
What are some of the other things that keep people away?
Some of the things are time. I find that people these days are so scheduled. They're working and they have families and they have children, and there's baseball practice and soccer and things. There's dance and so time sometimes becomes, believe it or not, an obstacle to going to the dentist or to having dental care done. I know I could speak for what we do at our office is that we have, extended hours. We have evening hours. We're open on Saturdays. So we do try to accommodate people that have some time constraints.
Do most people with busy schedules, would they rather have a lot done in fewer visits that are longer or a lot of shorter visits usually?
That's a good question. It depends. Depending on the type of job that they have, some people can take, they could come in the morning, let's say, and have 2 hours of dentistry done, and then they could go to work later on, depending on what their needs are. Some people could come in on their lunch break, and they could have treatment done, and then go back to work, depending on how far away they are from the office. So I do find that sometimes doing more treatment in a longer amount of time but fewer visits helps people manage their schedules a little bit better than coming to the dentist and having 20-minute or 30-minute appointments and feeling like they're not getting anything done.
Yeah, it's true. So what else is on those? So we had fear, we have time. What were the other three that you were going to mention?
Well, there's trust. Sometimes patients tell me after we've seen them, patients say, I wish I would have known about you sooner or earlier. Sometimes they feel like they just don't know where to go or who to go to. They haven't they really developed a trusting relationship with the dentist, so they may not know where to go or who to see. So we also address that issue, and we do spend a lot of time discussing what their needs are, answering questions, making sure that patients are comfortable with the treatment that they're about to receive. And if not, we could work through those things so that that trust issue really is not an issue any longer.
Most people probably aren't used to a consultative type relationship with a dentist. I think they're probably used to, you get your teeth cleaned, the dentist comes in, pokes around, says you need 2 fillings and a crown, make an appointment with Sally. They don't experience the type of interaction that happens in your office.
Absolutely. Most of the times when patients come, they're amazed at the process that they go to, and it's a good process that they go through, I should say.
Let's discuss that process, because I think what you do in your office in that respect is pretty unique, and I want our listeners to hear about what it can be like.
Sure. So what happens is if you're a new patient and you're coming into our office, let's say, we do spend a lot of time discussing with you what your needs are and what your desires are and what you're looking to accomplish out of your dental visit. So we don't sit the patient in the chair, tell them, like you said, that they have 2 cavities and they need to have some fillings done, and then we just schedule for that. We spend a lot of time taking x-rays and photographs and doing a comprehensive evaluation for our patients. And then we sit down face-to-face and we have a consultation, or I like to say a conversation, and we have a lot of computers in the office, and we sit down in a consultation room, and we have their x-rays and photographs and all their information right up there on the monitor so that the patient can see exactly what's going on in their mouths, looking at real photographs. And we could discuss what their particular needs are and what types of treatments that they'd like to have.
Do people usually bring a spouse or somebody else to these visits to be a sounding board, or how does that work?
Absolutely. We always invite spouses or significant others to come in with them at the consultation appointment. No treatment is done at that time. We just sit down, like we were saying, and we discuss what their treatments are, what their treatment will be, and what some of their options are, depending on what they're having done. So we always do. We always suggest patients bring in someone that they trust with them, so that they can hear what the treatment recommendations are.
Before we take a break, let's touch on the other 2. So we had fear. You mentioned time. You mentioned lack of trust. Now, what were the other 2 that tend to keep people away from the dentist?
There's money. And then there's people think that maybe there's no what we call sense of urgency. People say, maybe this isn't really necessary, or it's not hurting, so I won't fix it.
So that's a pretty common thing that I think people say in dentistry is, if it ain't broke, don't fix it. And what they're saying is, well, it's not hurting me, so let me just leave it. So what would you say to those people, or what's been your observation of people who take that approach?
Well, I could honestly say that people that take that approach usually end up being emergency patients. It's the patient that hasn't gone in for several years because, everything feels fine, nothing hurts, and then all of a sudden, boom, they wake up with something, with pain, or they have a swelling somewhere in their jaw, or all of a sudden when they bite down, a certain tooth hurts them. And because there are always things that can be lingering, and they don't hurt sometimes until it's too late. And those patients wind up becoming, like we said, emergency patients, and then we wind up treating them, and we resolve what their pain issue is, and then they become regular patients because they don't want to go through that again.
And it's always Sunday morning, the day of the christening or something special, right?
Exactly,
it's never a normal day.
Their kids are getting married that day, and they need to have, his tooth taken care of right away. Yep, that happens.
And, the last one you mentioned was cost, and I'm sure for all listeners, cost is on their mind, and I would guess a lot of these cosmetic dental cases run into big numbers. So are the people that do cosmetic dentistry, are they sort of the wealthy people in the community? Is it the average Joe doing cosmetic dentistry? How does the average, who is it that's getting this kind of work done?
We see all sorts of people getting cosmetic dentistry done. It's your local neighborhood people, people that are teachers, police officers, firemen, people that have that have professions where they need to do a lot of speaking or deal with a lot of people, professionals, accountants, attorneys, other physicians. So there are all types of people that have cosmetic dentistry done. One of the things which you brought up is that cosmetic dentistry, can be costly. There are different levels of cosmetic dentistry that one could have. That it doesn't necessarily mean that everything that can be done is going to be costly. So there are different levels of cosmetic treatment you could have, and oftentimes, depending upon what your budget is, we could work the treatment into your budget, so it's not a tremendous hit on your pocketbook.
We're going to take a fast break, and when we come back, we're going to talk about the results that you've seen from patients in cosmetic dentistry. So let's take a fast break. I'm Dr. David Scharf. You're listening to Healthy Living Radio.
You're listening to Healthy Living Radio with Dr. David Scharf.
Okay, we're back. You're listening to Healthy Living Radio. I'm your host, Dr. David Scharf. Our guest tonight, Dr. Danny Aldieri, the A in KFA Dental, the premier dental practice in Farmingdale and probably all of Long Island, truthfully. I know we were talking before the show a little bit. You had a great story you told me before the show about one of your oldest patients that you've ever done cosmetic dentistry for, and maybe you could tell our listeners about that story.
Was it the grumpy old man?
The other one, the woman.
Oh, the woman, yeah.
And then we'll talk about the grumpy old man, who wasn't really grumpy.
He was not really grumpy. I had, not too long ago, I had a woman who came in and, talking about the 86-year-old, she was 86, and she hadn't been to the dentist for a very long time. And she comes in, and she says that she would like to have some cosmetic dentistry done. And so, as we always do, we have a conversation, we sit down, and I asked her, what is it after all these years that brought you in? And she said something interesting. She said, all these years I've been putting my family first. My children came first, or my husband came first, and she was busy working and raising a family that, and years had passed by, and in the back of her mind, she always wanted to have some cosmetic dentistry done. And then her grandchildren had braces, and when her grandchildren had her braces removed, she saw them, and they were smiling. They were so happy that their braces were finally off, and they were smiling. And she just said, "That's it. It's time." And it's funny because it took her grandchildren's braces, for her, to come in and finally do something for herself.
So what kind of changes did you see in her? What did she say after it was done?
Well, the first thing she did is she started crying, and which is not uncommon, by the way. She was so happy and so joyful. I mean, there was like an emotional flooding that she had, and she looked in the mirror. We gave her the mirror, and she looked at her teeth, and she had the biggest smile, much bigger than when we first had seen her. And you could tell she was so elated with her new teeth that I think it changed her life. Even at 86, she was almost like a new woman.
Was she glad she waited till 86?
She definitely said she was
doing this a day before 85.
85, right? She waited until she was 86. No, she was. She told me she had done it sooner.
Is that
Absolutely.
common that most of the cosmetic people you treat with cosmetic dentistry, that they sort of hem and haw a lot? They really, it's a big decision to do it, but in the end, they kick themselves that they didn't enjoy it for so many years before.
Absolutely, we see that happening all the time. Anytime we do cosmetic dentistry, and we could change somebody's appearance and uplift the way they feel, or increase their confidence level. They always tell me they wish they had done this sooner. They want, and for the reasons that we spoke about, they may have stayed away. But they tell me if they could do it again, they would have done it much sooner.
It's funny, of all the things that can make you look better, losing weight is a real long time hard to do. Getting
Right.
physically in shape takes a long time. It's hard to grow new hair if you don't have hair, whatever it is. But when you think about it, teeth are so easy to control, to really give yourself the smile that you've always wanted.
They really are, David. When you think about it, you could really control in terms of the treatment that we do nowadays, and there's a lot of planning that goes into it. You can really control the results when you're having cosmetic dentistry done, and a lot of it has to do with planning, and really figuring out what the patient's needs are. But in the end, you could really achieve a result that you really want to. Yes, and it is easier than losing weight or growing hair or having plastic surgery done. That's for sure.
So let's so as not to cause a rampage here at the studio, tell us the story about the grumpy old man.
Not to offend
in our final minutes.
In our final minutes.
Not to offend either people that are grumpy older men.
In that order. There was a man who came into the office, and he was a grumpy old man. He didn't smile. He didn't make eye contact with anyone, and he kind of grunted when he spoke. But he came in, and once again, after speaking with him and interviewing him, we really found out that for many decades, he hasn't been smiling. He hadn't smiled. He didn't like how his teeth looked. He was almost embarrassed about his teeth, but he was, too much of a man to admit it or to seek help for it. So he was labeled this grumpy old man because he didn't smile. And the fact that he didn't smile, people labeled him as grumpy, and he didn't like his teeth, so he didn't smile, and it's kind of this vicious cycle. And so finally, he had his teeth fixed. Mm-hmm. And lo and behold, the grumpy old man wasn't as grumpy as we thought.
Really? So what kind of changes did you see in him when he came back with his new teeth?
The first thing he did was he tried to pick up the girls at the front desk. I mean, the receptionists at the office were on his list. So he was smiling. He came in with a smile on his face, and he was so happy he had it done. And so even though he may have had a grumpy personality when he came in, his personality did actually change.
Yeah, and you mentioned before that it's really pretty common when people finally sit up and see their new smile that they start to cry, that emotion just comes out.
Absolutely, and it's funny because it happens sometimes to people that you would not think that it would happen to, and it's almost like they can't really control it. They just see their teeth, and we sit them up in the chair, and they look in the mirror and they see themselves, and this emotion comes out where and maybe it was trapped deep inside, mm-hmm. and maybe it's something that they've been keeping pent up for all these years, and you make a change in their appearance, and all of a sudden it almost seems like they have this weight that's been lifted mm-hmm. from them, and now they could smile again, or now they could take pictures with their families again, and they don't have to maybe hold their hands in front of their mouth when they're smiling or speaking.
I would think of all the things you do in dentistry, that's probably got to be among the most satisfying.
Yeah, I mean, sometimes I get a little emotional when when I see the patients. They're so happy, and it's such a sense of gratitude that I have that I'm able to do this for them day in and day out. And so I'm truly blessed and grateful that I'm in a profession that allows me to change people's lives.
In our last couple of seconds, maybe just tell our listeners where you're practicing, how they can get in touch with you, if you have a website, that sort of thing.
Absolutely. The name of the practice is Con Ferrari in Aldieri. We're located right in the heart of Farmingdale, 375 Fulton Street. And if you want more information, you could visit us on the web at www.kfadental.com. That's kfadental.com.
Thank you very much. Danny, it was a great show. I
Thank you
enjoyed
so much, David.
talking with you, and I enjoyed your story about the grumpy old man who's not grumpy anymore. That was a good
Thanks,
one.
David. It was a pleasure being on.
Thanks for listening. You've been listening to Healthy Living Radio. I'm your host, Dr. David Scharf. We'll be back with you next week. Thanks for tuning in.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.